Hey everybody, today I am going to show you how to check the back end of your dog for any neurological signs. Now this is not supposed to be, very thorough neurological exam. This is something you can do at home and look for some simple signs and symptoms that may alert you of something and make you want to go get a further full neurological evaluation from your vet. Now these tests are going to be very easy to do at home. They're simple. I highly encourage you to do it on your healthy dog to understand what those signs and symptoms look like, what a normal test looks like, so that when the signs are absent or when the test is positive, it will alert you when something's up. The first thing that you can do is just observe what's happening with your dog. So if they're having dropout weakness in their hind end, or if they're dragging a foot while they're walking and you notice the tops of the nails are wearing down a certain way, which they normally shouldn't, or if there's any blood or scratches on the top of their paw that is consistently showing up, they might be dragging a foot. So keep an eye out for that. The other big thing that you have to be aware of is any inconsistencies with their bowel and bladder. So, if they have incontinence, that's something not to take lightly, and it's something I'd highly recommend to go and get looked at by your vet. Okay, so the tests you can do at home, there's 3 of them that I'm gonna show you, are very simple to do and there's no harm to the dog whatsoever. So once again, I encourage you to do this on a healthy dog so you understand what a good test looks like and a normal test is. So if there ever is an issue, it will alert you when it's showing up at home. So the first thing is just the paw writing reflex. So what you should do is flip the paw down and have them weight bear and try to put their knuckles down. If they stay knuckled, that is not a good sign. That is something you want to take in and look at the vet. A normal test would just be exactly what Bo's doing here, is he's writing his paw right away. He's very sleepy today. He's had 2 really good runs off leash, so he's pretty lazy. But normally a dog won't even let you do it, and they'll just replant, or they'll put their knuckles down and then quickly replant as a result. The second test you can do is where you do a pinch test in between their footbed here in the webbing of their feet, to make sure they have good sensation there, and they should pull away. So they should lift up their paw and pull away from your fingers when you're pinching in that area, and that is a normal test. If it's absent and they're just relaxed and they're letting you pinch away, then that is obviously another concern you should go and chat with your vet about. The last thing you can do is tendon reflex on the patellar tendon. So what you should see on here is just like when doctor comes and hits your knee with a reflex hammer. However, with dogs, you don't necessarily need that. They're very sensitive. It's easy to find their patellar tendon. If you follow down the front of their leg here to the knee, you'll feel the bony part, and then just below that, you'll feel what feels like on a dog both sides, it almost feels like a pencil, and it's about 1 inch long on him, just under 1 inch long. But you'll feel that if you move back and forth. So it's not gonna be tender on them. But what you're gonna wanna do is make them so they're not weight bearing. So you're gonna get him to bend his knee, and you're just gonna tap. And you'll see them kick out their leg quickly, just like it would happen with you. So I'll show you a couple other views of this so it's easier to see. And it's best to do this obviously non-weight bearing. If they're lying down, it's the easiest because you'll see the reaction and it'll be very apparent if it is there or not. So I hope that helps. I mean, it's a very simple test you can do at home. This is obviously not supposed to be a thorough neurological exam. It's just supposed to help you identify if there is an issue that should go looked at more thoroughly by your vet. Take care.